Doctor, what are the indications for circumcision operation?
Yeah, circumcision is basically removal of the foreskin. Apart from religious reasons, medical indications are there whenever there's a disease in the foreskin. That is, when it is very tight, non-retractile, beyond the age at which it is expected to retract, or if there is a condition called whitish patches, okay, when the child has got whitish patches there, which is a condition called balanitis erotica obliterans, or if the child has got some urological condition in which the child is prone for recurrent urinary infection like a vesicoureteric reflux, then circumcision is needed.
Which are the absolute indication, doctor?
Of these things, absolute necessity for circumcision is the condition I told, BXO, that is whitish patches appearing in which the skin becomes so tight that progressively it becomes tighter and tighter and tighter, and it can spread down to the inside part, which we don't have treatment for. So it is better to have a circumcision sooner than later.
So people say, is it really necessary?
There's a common misconception to say that circumcision is really needed so that the infection is avoided and it's for good hygiene. Frankly, it is not really needed. This is a misconception spread mainly by the Jews because circumcision is religiously needed and they had to find some reason and they propagated the myths. Even amongst the Western countries, even in America, there's a lot of groups which are now against compulsory circumcisions or religious circumcision. Religious circumcision is okay. For their sake, we will not fight with their faith. But a routine circumcision for all children, even in USA, there are a lot of groups against it. All that we need to do is to make sure that there's a local hygiene. And when the foreskin starts retracting, we have to teach the child how to retract the foreskin, clean up the area and pull it back. If this can be done, and if infection can be prevented, you don't need to really worry about the foreskin being a cause for non-hygienic reasons. No. The removal of foreskin is not really needed is not a substitute for other hygienic measures.
How much foreskin you really take it out, sir?
Yes. Good you asked me. Because in general people are in the worry whether, okay, when I take out the foreskin, is the sensitivity of the glands lost? And is it going to be impairing the child's pleasure points or whatever going to be there? And they're also worried about the cosmesis. Let me assure you very clearly that when we take out the foreskin, we take out only that much amount of foreskin that is needed to be taken. Generally, most of us leave a frill of the foreskin which can cover this most sensitive portion, which is the groove. The groove is going to be covered by the foreskin, and the most sensitive portion of the male organ is supposed to be the frenum. That is, on the undersurface, there's a little longish, tonguish like skin which is coming. We tend to preserve this. So, you don't need to worry that when you're doing a circumcision, we remove the whole thing. Maybe for religious reasons, some religious seers may take out the foreskin fully. But in general, we do not take out the foreskin because the function of the penis, whatever is there, should be available to the child as he grows by. It should not be denied to him.
What is the recommended age for this surgery, sir?
There's no real recommended age as such because many of the religious reasons they do it at birth. Some do it at 1 month. Even amongst Muslims, I've seen some people have habit of doing it 1 year, 5 years, etc. In general, I do not recommend it to be done before 1 to 1.5 years of age, mainly because it has to retain the sensitivity. 1. Number 2, we have to remember that if the circumcision, sooner we do, lesser the suffering, older we do, more suffering. For example, the circumcision when done for a 6 or 8 or 10-year-old boy, the suffering is much more as compared to, say, a 2-year-old child. Similarly, if you neglect everything and before marriage, in case he wants to do a circumcision, you can imagine the amount of pain and suffering he has. So if a circumcision is definitely needed, better to do it sooner than later.
You mentioned about the religious objection. How do you manage this, sir?
I think what you're saying is about the reservations amongst many communities, mainly the Hindus. I've seen many Hindus saying that I don't want a circumcision because it's more connected to the Muslim. Let me assure you, most of the pediatric surgeons do not recommend circumcision unless it's truly medically indicated. If it is truly medically indicated, please go ahead. I do understand that you may have reservations about circumcision, but when it is needed, it is really needed.
For this problem, is there any other options other than surgery? Like some people will say physiotherapy, some people will say some oil massage. All those things really help?
See, when I tell a non-retractile foreskin in a small child where it is not expected to retract fully, we still call it phimosis, but we call physiologic phimosis. That means it's naturally happening. That the process of retraction has not happened fully, but it is still within normal limits. In such cases where there is no problems or symptoms, we do not generally recommend, because any forceful retraction may cause actually little tears and can lead with fibrosis or scarring, and finally may end up in circumcision where perhaps originally it was not needed. So those cases where it is no problem symptoms, we don't do anything. However, we do get some children who may have local irritations, sometimes ballooning of prepuce when passing urine, or sometimes some local infection in which the phimosis is not very clear cut, or the indication of circumcision is still borderline. In such cases, we do have a role for medical management in which we give some mild steroid application there and advise some gentle retraction of the prepuce. When we say gentle retraction, we want it to be gentle. It's not a physiotherapy the way you call it, but it's a gentle retraction so that you can start retracting, and by applying the cream, you're basically making it softer and preventing scar formation. This has to be followed under medical supervision, only on the prescription of a doctor, and not forcefully do. Otherwise, you may end up doing a procedure which perhaps is not needed at all.
Sir, is this procedure painful, and how much time it will take to recover, sir?
Yes, it is definitely painful, no question at all, because no operation is without a pain. But we make sure that the pain is going to be mitigated to the maximum extent. These children, apart from general anesthesia and the painkillers that we give by systemic route, that is injections, we also do what is called as a caudal epidural block. That is, we give a small injection in the tailbone by which the entire bottom area becomes numb, by which about 4 to 6 hours of after the operation, you do not have any pain in the local area. And by the time child starts taking oral feeds, we give oral painkillers. Beyond which, whatever the child has is more than pain, it's a little degree of discomfort. The child cannot express too many things, so the child may continue to have pain, may say it is pain, nothing to worry. Let's all understand it's a very sensitive portion of the body, and each child's response to the same will be different. So some children are perfectly alright from day one, some children have some sort of discomfort for about a week. It varies from child to child. But trust me, we will tell you all the things that we need to reduce the discomfort and the pain of the child.
What type of clothes they can wear during the surgical procedure?
After the operation, as I told, there will be little amount of discomfort, little amount of swelling, little amount of soreness there. So it all depends on the child and its preference. If the child permits, yes, put a 3-piece suit, but most of them don't. So the best thing is to put some sort of lungi so that they become like a monk for about a week. They're all right. Whenever they are comfortable to put a chedi, you can. This is perhaps one reason why they may have to miss a school for about a week, mainly because there will be some amount of swelling by which they can't put chedi. Obviously, without chedi, nobody allows the school, no? That's why.
If you put the stitches and all, when are you going to remove it, and when the baby can go to the school? When we are supposed to see you after the surgery, sir?
In general, all of us put absorbable suture material because child is not going to permit us to take out the sutures there. So the sutures are absorbable. Generally, they are absorbed by about a week to 10 days because most of the sutures are like that design. So most of the times it should not be a problem. They can resume school whenever they are comfortable to put a chedi and go to school. If it is 3 days, 1 week, it is all right. It depends on the child and the mother and the parents and the level of anxiety that you have. So schooling is not a problem. In general, after the operation, I give all the instructions. I tell them, ask them to come after a week. Once they come back after a week, if everything is all right, you don't need to.
Sir, some people are asking it can be done by laser surgery, and some staplers are used during the surgery. Is it true, sir?
Yes, it is true about the stapler part. Yes, there are staplers which are available, and staplers, only thing is we need to choose a right side stapler and to apply it. They have a staple line of metal staple pins, but they fall off in due course. Yes, there are some surgeons offering, but I don't offer to all of them. Sometimes yes, but it's still not stood the test of time that it can be offered universally to all children. As far as laser is concerned, good for asking questions because a lot of people have this misconception saying laser is the advanced thing. You do it, everything will be all right, no suffering, nothing, God bless us. No. Laser is after all a type of energy. It does as much cutting as much as a knife, a scissors or anything else. Lasers are particularly useful for deeper cavities. For example, if it is deep inside the eye where you can't reach, deep inside the body like a prostate, yes, laser makes a difference because you can just, or a stone. Where it's not accessible from outside, yes, laser fibers can go into it. But what is there on the surface? Yes, you don't require any major energy devices because after all the purpose is served by anything else, like a common knife, surgical knife.